Questions remain about the safety of some clinical drug trials, studies to learn how successful a drug might be. If you know someone who's thinking about taking part in one of those trials, there are some new important guidelines you need to know, all put in place to protect patients. Tonight in this Fox 11 Investigates, Ed Lascos has the medical trial heartbreak of one local family.
That smile, that beautiful smile. He was fighting. He was fighting to be normal.
We were making plans for him to come home and be better.
The subject that they could test as a guinea pig.
Augustine Leo Liu. He died 6 years ago this past February. His sudden death still haunts his family. He had everything to live for.
It took away his chance. It took away his future.
He wasn't just a number. He was my son.
Liu was a number, a schizophrenic, taking part in a clinical study involving the drug risperidone. It's an antipsychotic drug to treat schizophrenia, at that time being studied by the drug giant Johnson & Johnson through its subsidiary, Janssen Pharmaceuticals. Liu, his family claims, saw the drug as a way to get his normal life back, one free of schizophrenia. He signed up and was then accepted and cleared for clinical testing.
He should have never been in that study to begin with. And when they got that lab work back, they should have said, you know what, we'll go find another subject.
This from the court complaint that alleges the doctor involved in the medical trial failed to, quote, properly conduct pre-study screening in accordance with the protocols outlined for the study. That screening involved lab tests on the blood, liver, and heart that a patient had to pass before being cleared for any trial injections.
Before he was injected, they knew on 2 separate studies that he had abnormalities on his blood work and on his heart work.
5 days after the first injection, Augustine Leo Liu was dead. We now know the doctor who was treating Liu before the clinical testing was this woman, Dr. Madeline Valencerina, the very same doctor who recruited Liu for the risperidone injections. The court complaint alleges Dr. Valencerina, quote, utilized her position as Liu's psychiatrist to convince Liu to sign a consent form, a referral that supposedly brought the doctor big bucks from the drug company.
It took $30,000 to enroll him into a study.
Liu's family says Dr. Valencerina had a conflict of interest and did not give Liu proper care.
They did not act as they should have, as they said they would. They more than dropped the ball.
That has left Dr. Valencerina and Johnson & Johnson and Janssen Pharmaceuticals now all facing a lawsuit brought by Liu's family. As the court complaint alleges, Dr. Valencerina, quote, failed to detect and or diagnose ongoing and worsening health conditions, symptoms of cardiovascular disease. This video from an earlier deposition where Dr. Valencerina is asked about the abnormal EKG test before the injection and why further extensive testing wasn't ordered.
There was something there. I can't exactly remember by memory that there was something abnormal. I reviewed his baseline, and then I went back and I reviewed his history. I also, because I've known him, and then when I went back to the hospital, I also talked to him and asked him if he were having any problems, and he denied having any symptoms.
Dr. Valencerina's attorney stressing Liu is given emergency care after the testing, and Liu's death had nothing to do with the trial. And the drug company Janssen Pharmaceutical in its statement saying, quote, the facts will show that Janssen acted appropriately in conducting and monitoring the clinical trial. As this lawsuit now plays out in the courts, there are questions that remain about the medical trials in general, and what some claim bring allegations of the unethical behavior of doctors. So much so, the medical industry is now reforming itself, trying to ease the side effects of what critics call a finder's fee. Dr. Frances Richmond is a professor of clinical pharmacy.
If you paid a finder's fee, you would not want that person who is incentivized in that way to be then involved in the informed consent process.
She's involved with the regulations surrounding clinical trials, the Center for Medicaid and Medicare, setting up this database.
What it shows is any payment that is made to a physician for any reason.
And then there is now a new informed consent form.
This is presented to the patient by a doctor who is not involved with getting any type of money from the drug company.
Correct.
Reform to cure the finder fee allegations that have sickened clinical trials for this family.
I don't think you ever get over it.
The Liu family has dealt with its loss for 6 years. Their lawsuit will be heard in court this September.